Hello, my name is Innocent. Welcome back to my channel. This is Work and Wonder. If this is your first time, please make sure to subscribe to the channel and turn on the notification button. And if I upload a video, you'll be notified and you'll come straight here and take a look at whatever video that I have uploaded. For the past few months, most of you, my subscribers, have been asking of the practical video of the assessment station, which is specifically the Manic phase. And today I'm privileged to have my friend back here as usual, who is going to help me to execute this particular station, which is the Manic phase of the mental health station. We are going to do it practically for you to see how it is done. We've already had a lot of discussion around the assessment station of the mental health Osce. We have the depression phase with suicidal ideation, and of course the Manic phase, or in other forms, some people refer to it as the bipolar, phase. And today I have with me here Collins, yes. As usual, Collins is going to be my patient. Most of you have been asking where is Collins. Today he's here. He's a very difficult guy. Yeah, very, very difficult to get him here on set for us to practically do it for you to see. But today we are here and then we are going to do it for you to see exactly how it is done. So we have a scenario here. I'll read a scenario and I'll also read the overview of the patient history. And of course, you know that with the manic phase, you'll either be given or will not be given the PHQ-9. So in this case, we are not going to be using the PHQ-9. We are only going to use the candidate note. We'll use the scenario itself, and of course, the overview of the patient history that was given us. So what I'm going to do is I'm going to read the scenario and I also read the overview of the patient history. I also project it on the screen so that you can read along and you know exactly the type of patient that we are dealing with. This is a manic patient and he's going to act typically like a manic patient. So that you see exactly how they can act, and then at the end, we'll see how we'll be able to do our assessment within the 20 minutes. But of course, in this time, it is not going to be 20 minutes because we are going to do some bit of intros like we are doing. Of course, we are also going to do a bit of outros, and I will have to also read a scenario for you to also hear exactly the type of scenario that we are dealing with. So without wasting much time, I'm going to be the assessor.
And I'm going to be the
patient. And then we are going to go straight into starting the scenario. So I'm going to get up and then I'm going to read the scenario and I'm going to start the whole station. So the scenario is that you're a mental health nurse within the mental health facility. Collins Glenn has been referred to your ward by the A&E because of manic behavior on a train, who was brought in by the police this morning to the A&E. You are to go there to go and do the assessment for Collins, who is currently on admission at the A&E. So typically, this is an admission-based scenario that we are going to tackle. Now, with the presenting or with the overview of the patient history, he has episode of manic behavior on a train brought in by transport police to the A&E. In terms of his history of presenting complaints, Collins displays impulsive, delusional, erratic behavior that concerns his wife and his parents. Collins suffers with prolonged episodes of excessive energy, big ideas of becoming one of the richest person, which is delusional, and then uninhabitable, concerning behavior in the public as well. And then he suffers with prolonged bout of sleeplessness and often sleeps only 1 hour or 2 hours a night for weeks. Collins has not had any therapy recently. Collins is on medication for bipolar but has reported that this has not helped with current episode of mania. Collins has a very poor appetite when he is in the manic state or in the depressive state and does not eat or drink for prolonged periods. He also got intoxicated in the manic state, which he was hostile to his wife and baby. In terms of his past medical history, he has bipolar, which was diagnosed 4 years ago, and then he has headaches and then acne and sometimes constipation. In terms of social history, parents live nearby, they visit on daily basis. He has a 3-month-old baby and he's been married for 4 years. He has no pet. He lives in a 2-story building with his wife. He has been a librarian for many years and is out of work now due to his mental health issues and is on disability benefit. He is a non-smoker. He drinks when in the manic state and can be aggressive sometimes. In terms of his drug history, he's on lithium, 400 milligrams on daily basis, and then Docusate, sodium, 200 milligrams, and then, of course, diazepam, 25 milligrams or as a PRN. So yes, this is the overview of the patient history. Now we know about the patient, we know the scenario that we are dealing with, and I'm going to start my station. So Collins is already in the ward, so I'm going to start. So I'll enter into the scene. I'll check for scene safety. The scene is safe for me and for my patient who is Collins. I'll draw the curtains to ensure privacy of my patient, privacy and dignity of my patient. I'm going to do a hand rub according to the WHO guideline, which is by putting an ampoule of gel in my palm, palm to palm, palm to back, fingers interlace, fingers interlock, rotational rub of the thumb, of the fingertips, of the wrist, My hands are clean and dry to approach. Hello, good morning.
Good morning.
Yeah, my name is Enos. I'm one of the mental health nurses here on the mental health unit. And as referred by the A&E doctors, I am here to conduct a mental health assessment for you using the recovery model of care. Is this a good time for us to do so?
You can do whatever you want. I generally don't care. I'm just focused on my forex. I'm feeling very angry because I can't believe I lost that amount of money. Is it okay for me to leave? Can I leave?
Well, Collins, I can assure you that this particular assessment that I'm here to do is for your own good. It is to assess you to know how well you are doing in terms of your mental health. I know that you've had issues lately, which has gone to the extreme, and that is the more reason why I'm here to, assess you, and then we are going to try as much as possible to find interventions to help with that. Is that okay with you, Collins?
You can do whatever you want. I don't really care. You can do whatever you want.
All right, Collins. Can I have my seat?
Sure, you can have your seat.
All right, thank you very much. All right. So Collins, how are you today? Is that okay if I call you by your first name, Collins?
It's all right. Are you sure I can leave?
I promise you this is for your own good. If you would give me some few minutes of your time.
Do you know anything about forex?
I really don't know anything about it.
Because I really should be the richest man in the world, you know?
I understand, Collins.
I can't believe I lost that amount of money. I was hoping to liberate my family.
Sometimes it does happen, this is life. And then some of these things does happen, Collins. Before we even continue, I want to be sure that I am with the right patient. Can you please tell me your name, your full name, and then your date of birth?
My full name is Collins Glenn. Date of birth is January 15th, 1980.
All right, so Glenn Collins, January 15, 1980. As also, I can confirm that I am with the right patient. All right, Collins, as I said earlier, I'm here to do an assessment for you using the recovery model of care. I know that recently you've been going through a lot. You've gone through a lot, which has seriously or significantly impacted on your mental health. Would you tell me what has been going on, Collins?
The thing is, I know I should be one of the richest men alive, and I've been trying to make investments so that I can help my family build. I can't believe I lost that amount of money. Now, I've been very upset lately. I just need to leave. I can't be here. I can't.
I can understand your frustration, Collins, but if I may ask, is it because you lost the money that is why you are in this state now? Is that what has put you in this state now?
That is what I believe. I'm not sure. Yeah, I think so. I don't know. They say something about me doing something on the train. I can't really remember. All I know is they brought me here.
All right, so you can't really remember what happened on the train?
I can't really recall what happened in the train. I have no idea.
All right, I can understand that sometimes it does happen, especially in your state when you are in your manic phase. Some of the things that you do, you might not be able to remember, but that is one of the reasons why I'm here. I'm here to, have this assessment with you so that we are going to try as much as possible to explore interventions around this so that you'll be very much aware of some of these things when it is happening. Is that okay with you?
That's all right. I just want my crypto to go up. I don't know what is going on.
Yeah, I can understand that, Collins. I don't really know much about, your cryptos, but I can assure you that if you cope and then we are able to go through this assessment at the end, I'll be more than willing to listen to some of the great ideas that you have about your cryptos. Is that okay?
Okay, no problem. Just go on.
All right. So what happened on the train, you can't remember, but is that the first time it's happening? Because in your notes, I can see from what the A&E gave me that it has happened before when you were even at home? It has been going
I
on for
don't
a
know.
while now.
People tend to blow things out of proportion. The thing is, I am the type of person that occasionally I get very worked up. You know what I mean? And currently, it's not easy trying to be one of the richest man alive. I'm really working my best, putting in the effort, and sometimes it's okay. I get worked up, and people keep acting, saying that I'm acting out. I'm not. It's
Yeah,
just
I can understand that, Collins. I can fully understand your frustrations about when things doesn't really go on and then how it can significantly impact on your mental health. And I can clearly tell you that you losing the money has significantly impacted on your mental health and is causing a whole lot of issues. But that is the more reason why I'm here for us to have this assessment so that we'll be able to see how I will or how we'll be able to help you in that regard.
mhm.
I can clearly see that you've been married for the last 5 years. You have a kid, 3 month old baby. How has that been going on? How are you
Mm,
getting along with them?
I would like to think I'm getting along with them. I like to think I'm getting along with them, although there was an incident where they said I hurt them or something, but it wasn't intentional, Like I said, I get worked up. It wasn't intentional. I didn't mean to do it, but it
Yeah.
just happens because I really have a lot going on. I'm trying to achieve a lot, and it's just one of those things that happens. I don't think I would do it again. I don't know, but I'm just trying my best, to make this money. You know what I'm saying?
Yeah.
I have investments that have fall through. I'm feeling very sad. I'm feeling very upset, and just it's been going. I guess it's been going.
Yeah, you said they said you tried to hurt them. Was there anything that caused that?
There wasn't anything that caused it. I don't think. I was just walked up. Nothing really.
Because it's stated that you were a bit intoxicated and
Well, when I get worked up, it's normal for anyone to drink. You know what I'm saying? And anyone would drink once they get worked up. And I just took a few pints, and it's just normal. It's
yeah.
nothing.
So is this something that has been going on for a while now? Whenever you're in your manic state, do you tend to drink
Well, I know I tend to
alcohol?
drink when I get worked up, but I don't know. Just occasionally, yeah, I do tend to drink.
So
Everybody
on
drinks.
okay, on weekly basis, like how many pints do you think you take when you are worked out?
Well, anywhere from 5 to 10 or more. It all depends on how worked up I am, and I'm trying to relax, and it all depends. I can't really give you a number from anywhere from 10 or more. It all depends.
Yeah, I can understand that most people do take drinks or do take pints when they are either excited or they are worked out, and it helps to calm them down. But Mr. Collins, in your situation, taking of drink when you are in a manic state can really, really lead to something that you might not want, just like what happened. So I will try as much as possible to encourage you not to have not to resort to drink when you are in your manic state, just for your own safety and then for the safety of your family as well.
I would try, but I'm not sure how I can abstain from it because every time I get worked up, it just gets so much. I just feel like I need a drink, and it's normal. Everybody drinks. It's
Yeah.
yeah, everybody drinks. I don't know.
So mainly it means that you cannot control it. You just have to resort to that.
Yeah, I wouldn't say I can't control it. It's just that I want to drink and I need to have a drink. You know?
Yes, I can understand that. I can understand that perfectly. But as I said, in your situation, it can be really, really worse for you if you like to resort to drink, especially when you are in your manic state. Um, how has your Liberian work been going?
I haven't worked in the library for a while now. I couldn't cope with the place. I'm trying to be rich, and you can't be stuck in the library when you're trying to make money. You know what I'm saying? So
Yeah.
I just felt like I couldn't cope with it, and I've been on benefit anyway. But I couldn't cope with the work. It's just not for me. I know I'm destined for bigger things. And I'm trying to achieve them, but it's not been easy. Just
Yeah.
been stressed.
So the benefit that you are getting as a result of you not working, is it enough for you and your family assistance now?
Well, we are making due. We are making due, which is why I feel very sad that I lost this amount of money. I feel very angry. Crypto is just.
I can understand your frustration about this whole investment that you lost that is leading to some of these mental health problems or issues. that you are having. But then I feel that if we are able to get along and then able to curb your mental health issues, it might go a long way to bring you back on your feet. All right. Okay. In terms of, I've seen that you are very well kept today. Has this always been the situation in terms of taking care of your personal hygiene?
When there's a yeah, I tend to take care of my personal hygiene. I tend to take a bath every now and then. It's not every day, but most days, yes.
All right. Um, it is stated or is documented that you are not having much sleep within weeks. You have 1 to 2 hours.
Well,
How?
when you're trying to achieve something great, you don't really have time to sleep.
Yeah,
You know what I'm saying? You don't really have time to sleep when you're trying to achieve something great. So I would say yes, two hours, but that's because I'm trying to achieve something great.
I can
You know,
understand that. So do you mean that within a day you only have like 2 hours sleep?
within 2 hours, yes, thereabout, yeah, yeah. Because I'm always focused on my goal of what I have to do. I have to have my family.
Yeah. So what you're saying is that you spend most time trying to focus on trying to get rich, um, at the detriment of you sleeping, having enough rest for yourself.
Well, when you put it like that, I just think that if you're trying to be great, you don't need that much rest.
Yeah, I can understand that. But then one thing you also have to know is that once you are not sleeping, it is going to significantly impact on your mental health. It can make you agitated, it can make you hostile. So you should try as much as possible. So in a day at least, you should have, if for now it is just two that you're having, I would advise that you increase it to about 4 or 6. Do you think this is something that you'll be able to do?
I honestly have no idea. I honestly don't know. I don't know. But
All
I'll
right.
try.
Yeah, that will be fine. It'll be worth giving it a try. Um, Not only that, how has your eating pattern also been? I've seen that you are not really eating as well.
I tend to forget. I plan to eat, but then I have a lot going on and I just forget. I don't think food is that important now. Oh.
Is it that you feel food is not important for you or you just don't have the appetite to eat?
Well, most times I don't have the appetite, and then even when I do want to eat, I forget because I'm busy on a lot of stuff.
All right. Collins, I must say that food is something that keeps us alive. And once you do not eat, then you are going to be very weak, and that can put you at high risks of malnutrition. Um, so I would advise that you try as much as possible to eat whatever is available for you in the house when you have the chance to do so.
I'll try, but I don't feel weak. I feel filled with energy, so I don't think I need it that much. But anyway, I'll try.
Yeah, at the moment you might not feel that you don't need it, but as time goes on, this can be of this can put you at serious risk of malnutrition, which might not be good for you physically and then mentally. Is that okay?
Okay, no problem. Whatever you
Oh,
say.
that's fine. Colleagues, I can also see that you are on some regular medications for your bipolar. Do you know the medications you are on?
I know I'm on lithium and some other medication, but I've not been taking them for a while. I don't really remember most times, and I've just forgotten because I've been busy and I don't know. I've not been taking them for a while. That's just it.
Yeah, you're on lithium 400 milligrams 2 times a day. You are on Ducosate 200 milligrams, and then of course you are on diazepam 25 milligrams PRN as well. These are the medications you are on. And you said you have not been taking them.
I've not been consistent. I try to remember, but I've been busy and I generally don't remember. I don't know. I don't think I need those meds. I don't know. I don't need them. I have a vision. I have a vision. I have a goal. I don't need those meds.
All right. So clearly, is it that you don't know what this medication does for you? That is why you feel you don't need them.
Well, I don't really understand what they do, but I don't understand what they do. I don't understand how they're supposed to help me. I just think I should focus on my goal of trying to be the richest man. I think that's more important than any medication.
Yeah, Collins, I must say that medication is can be really, really, really good for your mental health. You've been on these medications for the past 3 years, and honestly, that is what has been keeping you going. It has been trying to help to stabilize you. The fact of the matter is that if you do not take these medications, you always relapse. And if you are not focused, then how do you achieve that goal of you becoming rich? So first of all, your mental health needs to be stabilized, or it needs to stabilize before you'll be able to focus on these things. So I'll try as much as possible to also encourage you to take your medications as prescribed. Do you think this is something you'll be able to do as well?
I'll definitely try. I'll definitely try. I'll try to take it.
All right. So, Collins, again, on the very last thing that I want to ask, have you had any thoughts? Are you currently, or have you had any thought of self harming yourself
No,
or
no, no,
harming
no, no,
others?
not really. No, I don't have any thoughts of hurting myself. I'm just currently focused on trying to be rich. I don't have any thoughts. You can't want to hurt yourself when you're trying to be great. You know what I mean?
Yeah,
Oh, not really. No,
I can understand that. And then any thought of harming others as well? Have you?
no, no. So some people say I tend to get aggressive, but it's not intentional. You know, people act out when they get drunk. It's not something I do intentionally. I don't feel like hurting people. It's just one of those things. I'm just walked up. You know.
So it's only when you are drunk that, such impulsivity comes
That's what
in
people say.
terms of.
Yes, that's that what mostly happens. Yes.
All right. All right, Colin. So clearly, it's evident that you kind of need help here because, as it stands now, there are some current risks that are prevalent that I want you to know. And then at the end, I will want your view on that. Currently, currently you are non-adherent to your medication as it stands now. You are also highly elated in terms of, your mood, and then again you're having difficulty in sleeping. You barely have sleep within weeks or within weeks. Again, you are not also eating, which clearly, if nothing is done about it, is going to put you at high risk of malnutrition. All these risk callings, if there are no interventions put in place for these risks, this can seriously deteriorate your mental health. So these risks that I have mentioned to you, Collins, do you think these are things that you will be able to manage if you are discharged back onto the community? And then, uh, do you think that you'll be able to keep yourself safe and then treatment will continue in the community for you in terms of you taking your medications, in terms of you, adhering to,
Honestly,
sleeping?
I don't know. I don't know. I'm just currently focused on what I want to achieve. I have no idea. I will try, but I'm not sure if I can. I'll definitely try, but I generally don't know. But I will give it a try if that's the best suggestion. I don't know.
All right, so Collins, in my professional opinion, I would recommend an admission for you onto the mental health ward because clearly we need to work around these risk factors to be able to bring you back to shape because you clearly have lost your focus and we need to bring you back, on focus.
Do I really need
Um,
to be admitted?
yeah, this is something that is really, really going to help you. I know that you have a very soft spot for your baby, your 3 month old baby, and then your wife. And when people are said to you that when you were drunk, you were aggressive to them, I know you felt very, very bad for them. And I know you don't want this to repeat itself. Clearly, you will need some form of help. And we, the nurses or the health professionals that are on the ward, will be able to provide this professional help that you need. If you agree to this admission, whilst on admission, all aspects of your care would be explained to you. There's always a nurse on the shift who we will be able to talk to. The nurse will be willing to have one-to-one sections with you, which can be very, very beneficial for you on daily basis or on shift basis. They are also going to assess your mental health, your thought, your mood, your affect. Again, with your medications, because you are not adherent to them, your medications will also be administered to you on daily basis, as well as we referring you to psychology. We have a very good psychologist on the ward who will be able to talk you through talking therapies, especially for people like you who have lost an investment or who have gone into some situation where you daily think about it. You have a psychologist who can do very good talking therapies for
But
you.
if you think that's the best thing and it will stop me from hurting my daughter, at least I don't mind. I don't mind. I don't mind going for an admission. I don't mind.
Yes, good. So, yeah, this is something that is going to be very, very beneficial for you. Would you want your daughter and your wife to visit you? This is something that can also be arranged if that is.
Definitely, definitely. I would want them to visit me. I would like to have visiting days with them if that's possible. Yeah, yeah, definitely.
All right, that's fine. So, straight away, I'm going to make that recommendation to the A&E doctors who referred you to me that we have done the assessment, we've gone through the assessment, we've gone through it, we've been able to identify some current risks which is prevalent, and then you have agreed to the fact that you need some form of help to be able to intervene with these factors, these current risks that we have identified, so that merely as possible the referral can be made to the acute mental health ward where I work, and then we'll commence our interventions immediately as possible. Is that okay with you?
Yeah, that's all right. That's all right. Yeah,
All
that's all
right.
right.
Do you have any questions with regards to your admission onto our ward, which is
Oh
acute
no,
mental
not
health ward?
really, not really. I don't have any questions. I don't have any questions.
All right. In
Yes.
that case, thank you very much, Collins. I'm going to make my recommendation immediately as possible to the A&E doctors, and then we would start the transfer process
Okay,
immediately as
no
possible.
problem, no problem, no
All right.
problem. It's
Thank
all
you
right.
very much for your time, and
Okay,
then I would want you to have a nice day.
no problem.
All
Cheers.
right. I'll see you on my ward.
Okay, cheers.
All right. So, Assessor, I will end my station here, and I'll also do a last hand rub according to the WHO guidelines: palm to back, fingers interlace, fingers interlock, fingers interlock. Rotational rub of the thumb, of the fingertips, of the fingertips, of the wrist. My hands are clean and dry. All right. So, subscribers, that is a very challenging patient. Very, 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 very challenging. So clearly you could see how manic patients behave. You are trying to make a point and then they are always trying to interject. But then anytime you are very compassionate and you give some form of reassurance, it tones them down a bit. So that is clearly how you can work your way around patient who is very, very manic-like. A patient that we have here, Collins, you can see clearly that all he was focused on was on his forex and forex and forex. But then I try as much as possible to find a way around that. That is inculcating his interest of the forex into the sort of intervention that I would want to offer him. And whenever I do that, you can clearly see that he becomes a bit attentive and then he gets to it. And at the end, we're able to get him to consent to an admission onto my ward, which we are going to explore interventions together to help him to, help with his manic symptoms and of course bring him back, or which we are going to help him to improve upon his mental health. So clearly that is how, the assessment is done. This is in our own view or our own understanding of the marking criteria, how you'll be able to do your assessment as in the manic phase. So yes, if you've not subscribed to the channel, please make sure you subscribe to the channel, and of course you turn on the notification bell. Anything for you to say before we wrap this thing up, Collins?
Well, nothing much really. It's just like he said. Most likely, you meet a very difficult patient who is hyper focused on a topic, and you have to find a way to walk around that. And most times, you have to be reassuring so that they can listen to you and be able to get back on the topic at hand. So, generally, just do your best.
All right, so that has been it for today. Until we see you in our next video, it's a bye for now. And please don't forget to subscribe and share to other people who are much interested in the topic of the mental health Osce. It is a bye for now.